Burning fat through breathing exercises and meditation might sound far-fetched at first, but recent evidence is challenging the old assumptions. The notion that mindful breathing and meditation could play a meaningful role in body recomposition, losing fat without necessarily losing overall body weight, has caught the interest of both scientists and everyday people seeking sustainable, holistic approaches to health. In this exploration, we'll take a closer look at these unconventional tools for fat loss, the science behind them, and how they are being integrated into modern wellness routines. Let's begin with a look at body recomposition, a concept that has transformed the way we think about getting fit. Rather than focusing solely on the numbers on the scale, body recomposition is all about reducing fat while maintaining or even increasing muscle mass. The goal is a leaner, healthier body, not just a lighter one. Traditionally, this has meant rigorous exercise and strict nutritional plans. Yet, there's growing recognition that factors like stress, hormonal balance, and even the way we breathe can influence how our bodies store and burn fat. Recent years have seen a surge of interest in techniques that go beyond the gym or kitchen. Among these, breathing exercises and meditation are standing out, not as mystical or fringe ideas, but as practical strategies supported by emerging research. One particularly notable method comes from Japan, the country often at the forefront of wellness innovation. Dr. Masashi Kawamura, a Japanese physician, has drawn attention for his walking and breathing method, designed specifically to burn fat. Dr. Kawamura's technique is deceptively simple. It involves synchronizing your breathing with your walking rhythm. As you step forward with your right foot, inhale deeply and contract your abdominal muscles. As you step with your left foot, exhale slowly, relaxing and expanding the abdomen. This mindful engagement of the core with each breath does more than just oxygenate the body. It activates deep abdominal muscles and increases calorie expenditure. According to Dr. Kawamura's own report, using this method over the span of 3 months led to a personal weight loss of 10 kilograms, or about 22 pounds, and a reduction of 17 centimeters in waist circumference. The method's appeal lies in its accessibility and ease of implementation. There's no need for fancy equipment or grueling workout sessions. Instead, it's a matter of bringing awareness to the breath and movement, a practice that anyone, regardless of fitness level, can incorporate into daily life. This is a striking example of how subtle changes in our habits can yield significant results over time. But how does something as basic as breathing, combined with gentle movement, help burn fat? To understand this, we need to look at the broader effects of breathing and meditation on metabolism and stress. When we're stressed, our bodies release cortisol, a hormone that, in high and sustained levels, can promote fat storage, especially around the midsection. Chronic stress is also linked to emotional eating, the tendency to reach for high-calorie comfort foods, often sabotaging weight loss efforts. Breathing exercises and meditation are proven tools for reducing stress. Controlled, deep breathing activates the parasympathetic nervous system, the body's natural relaxation response. As you inhale deeply and exhale slowly, your heart rate slows, blood pressure drops, and cortisol levels decrease. The result is a state of calm that not only feels good, but can also support healthier metabolic function. In the United States, the integration of mindfulness-based practices into weight management programs is gaining traction. The American Heart Association, for example, has recognized the benefits of meditation in reducing blood pressure, a condition closely tied to weight gain and metabolic health. By lowering blood pressure and reducing stress, meditation may indirectly support weight loss goals. While large-scale, long-term studies are still needed to pinpoint the exact amount of fat loss directly attributable to these practices, early results are promising. Preliminary studies and numerous personal accounts suggest that people who regularly practice mindful breathing and meditation find it easier to stick to healthy eating habits, are less likely to binge or stress eat, and may even notice subtle shifts in their body composition over time. Some individuals have reported losing as much as 11 pounds, or about 5 kilograms, through consistent practice, without drastic changes in diet or exercise. It's important to note, however, that breathing exercises and meditation are not magic bullets. Experts emphasize that these methods are most effective when used as a complement to other healthy habits, such as balanced nutrition and regular physical activity. Still, the potential of these mindful practices to enhance fat loss and overall well-being is becoming increasingly recognized. Let's delve a little deeper into how to put these principles into practice. The walking and breathing method, as popularized by Dr. Kawamura, is a great place to start. To try it, begin by walking at a comfortable pace. As you step with your right foot, inhale deeply through your nose, drawing the breath down into your belly and gently tightening your abdominal muscles. Then, as you step with your left foot, exhale slowly through your mouth, allowing your abdomen to relax and expand. Repeat this cycle, matching your breath to your stride, for at least 10 to 15 minutes a day. Over time, you can gradually increase the duration and pace as you become more comfortable. Another effective approach is to integrate seated breathing exercises and meditation into your daily routine. One popular technique is diaphragmatic breathing, sometimes called belly breathing. To perform this, sit or lie down in a comfortable position. Place one hand on your chest and the other on your abdomen. Inhale slowly and deeply through your nose, feeling your belly rise as it fills with air. Exhale slowly and completely, noticing your belly fall. Aim for a slow, steady rhythm, perhaps 5 to 6 breaths per minute. This type of breathing has been shown to reduce anxiety and promote relaxation, making it easier to resist unhealthy food cravings and emotional eating. Mindfulness meditation, which involves sitting quietly and focusing on your breath, thoughts, or sensations without judgment, also offers powerful benefits for weight management. By cultivating awareness of your body and mind, you become more attuned to your true hunger and fullness signals, making it less likely that you'll overeat out of habit or stress. In one study, participants who practiced mindfulness-based eating awareness reported eating less and feeling more satisfied with their food choices. The beauty of these practices is their flexibility. You can incorporate them into your day wherever you are, at home, in the office, or even outdoors. For those with busy schedules, even a few minutes of mindful breathing can make a difference. The key is consistency. Just like with traditional exercise or healthy eating, the benefits of mindful breathing and meditation accumulate over time. Let's not forget the role of community and support in sustaining these habits. In recent years, group meditation and mindful walking sessions have become increasingly popular, both in person and online. These gatherings provide a sense of accountability and connection, making it easier to stick with new routines. Many people find that sharing their experiences and progress with others keeps them motivated and inspired. As with any wellness trend, it's important to approach these methods with a critical eye. While personal stories and early research are encouraging, more robust scientific studies are needed to fully understand the mechanisms by which breathing exercises and meditation contribute to fat loss and body recomposition. Still, the anecdotal evidence is hard to ignore, and the risks are minimal, making them a worthwhile addition to any health regimen. Let's return for a moment to the idea of body recomposition. Traditional weight loss often focuses on the scale, but as we've seen, it's possible to lose fat and gain muscle simultaneously, resulting in a more toned and healthy appearance without significant changes in overall weight. This is particularly attractive for those who want to improve their body shape and health without resorting to extreme diets or exercise routines. Breathing exercises and meditation fit naturally into this philosophy, offering gentle yet effective ways to support the body's natural processes. It's also worth highlighting that these practices can be especially helpful for people who struggle with physical limitations or injuries that prevent them from engaging in high-intensity exercise. For older adults, those with chronic pain, or anyone new to fitness, mindful breathing and meditation provide a low-impact entry point to better health. The cultural roots of these practices run deep. Breathing exercises have long been central to traditional Asian health systems, such as yoga's pranayama in India and qigong in China. These traditions recognize the breath as a vital force that influences both physical and mental health. Modern science is now catching up, offering new insights into how these age-old techniques can can be adapted to contemporary lifestyles. As more people experiment with mindfulness, breathing exercises, and meditation for fat loss, a few practical tips can help maximize results. 1. Start small and build gradually. If you're new to these practices, begin with just 5 minutes a day. As you become more comfortable, extend the duration or add in additional sessions. 2. Combine with light activity. As shown in Dr. Kawamura's method, pairing mindful breathing with gentle movement, such as walking, can enhance the benefits. 3. Be patient and consistent. Results may not appear overnight, but with regular practice, subtle changes in body composition, energy levels, and mood can become apparent. 4. Use technology for support. There are many apps and online resources that offer guided breathing exercises and meditation sessions, making it easier than ever to stay on track. 5. Listen to your body. Pay attention to how you feel during and after each session. Adjust the intensity and duration to suit your needs and comfort level. For those who are skeptical, it's worth considering the broader context of wellness research. Increasing numbers of studies are pointing to the interconnectedness of body and mind. Stress, sleep, emotional well-being, and even the simple rhythm of our breathing all play a role in how our bodies store and use energy. By paying attention to these factors, we can create a more holistic and sustainable approach to health. In summary, the idea that breathing exercises and meditation can help burn fat and reshape the body is no longer as far-fetched as it once seemed. Thanks to innovators like Dr. Masashi Kawamura and the growing body of scientific research, we now have practical techniques that are easy to integrate into daily life. While these practices should not replace balanced nutrition and regular physical activity, they offer valuable support on the journey to a leaner, healthier body. If you're looking for a fresh approach to fat loss and body recomposition, why not give mindful breathing and meditation a try? Whether you choose to follow Dr. Kawamura's walking and breathing method, practice seated breathing exercises, or explore mindfulness meditation, you might just discover that the path to a healthier you is as simple as taking a deep breath, one step at a time.